Welcome, everyone. We are here for our next episode, a special episode of Brighter Days Through Better Movement. We are here to help you be the healthiest, happiest, most active you can by the summer solstice on June 20th. And today I'm joined by Dr. Madom. Dr. Madom, thank you for joining us.
Thank you for having me. Really appreciate it.
Well, it's funny. I think that we first did a podcast together maybe 3 years ago. We were lucky enough to do it in person down at your East Greenwich office at Ortho Rhode Island. And it feels like a lifetime ago. We've all had a really challenging year, dealt with the pandemic, and but we seem to be moving into a better place. Tell me, as this pandemic comes to an end, what are you most looking forward to?
So, personally, I think that, there's so many things that have been put on hold and feel like a lot of us feel like our lives are delayed. And, even us delivering healthcare, we feel the same way. I can tell you on a personal note, live music is something that I cannot wait for that to come back. I know we're not quite there yet, and there's going to be certain restrictions on how it's done, but I'm a fan of live music. I had tickets to, there's a band, Tedeschi Trucks Band. It was a blues rock band that my wife and I had tickets for last summer. This summer has now been delayed till next summer, so we're not going to get to see them until next summer, but I'm hoping by sometime in the summer or fall we get out to do some live music.
So if you had the choice to take your wife or me or anyone to a concert, what would be the number one artist you would want to go see?
Oh, by far Foo Fighters.
Oh my goodness, I love it. Can you take me? Yeah, wouldn't that be amazing?
I've seen them multiple times through the years. I actually, for hopefully I don't get judged on this, but my 3 sons, 2 of them at the time were 12 and one was 9. That was their first concert, and they were just like at Fenway a few years ago. They were like, so it was great.
Oh, you're a cool dad.
I try.
You're taking your kids to Foo Fighters. You're not the only orthopedic surgeon out there. I know one of your colleagues, Dr. Wynne Alfred's a Foo Fighters fan as well. So yeah, maybe it's an orthopedic surgeon thing.
Yeah, I think it's also just the time. Yeah, when I was in high school, I listened to Nirvana, and I think I was a senior in high school when Kurt Cobain died, and I just had always been a fan of Dave Grohl. So it's and I think that if you follow some of what he talks about, just lifestyle and talking about, he kind of has this really good approach to balancing music and fun and life, and taking what he does seriously, but not taking himself too seriously. So I like that.
Well, it's nice to have those life lessons. And when you hear music that makes you think of positive things in those ways, it's awesome. Yeah. So no doubt you listened to plenty of Foo Fighters over the last year, but the pandemic obviously caused many challenges for people, and we used music, exercise, whatever we could do to manage that. But you're an orthopedic surgeon, or you're a spine guy. How did your practice, the patients, or how did the care you provide evolve over the last year? Any big changes, anything that you learned from it, and anything that will change how you practice in the future? Sorry, there's like 10 different questions in one.
Yeah, I think that, there's a lot there, right? So there were things that we were forced into. Telemedicine, right? I think that we were forced into it. A lot of us wanted to embrace telemedicine beforehand, and for better or for worse, the insurance companies said, well, that doesn't count as a visit. And the documentation of it was weird. We still did some of it, but in a different way. We didn't really have access to the platforms and to make it a useful experience for the patient. It just felt like something that was done ad hoc, just an add-on. And we got forced into this situation where we had to embrace it and say, okay, we got to figure this out. And we got to do it in a way that the patient doesn't feel like it's just a phone call. It's like, this is a visit, because a lot of these people can't come in. They don't feel comfortable coming in. So we did a lot of that, and I continue to do that. I think that patients now that they're able to come to the office, there's been a little bit of a drop off, but I think that there's opportunity there to expand who we see, and really expand the way that we interact with patients. So I think telemedicine is a big change. Another thing that I noticed in my practice was that the acuity of the patients that I saw, patients really weren't coming in unless they had a big issue,
Mhm.
right? If there were a lot of things that they may have come to see me in the past, which they would they you know they were like they're pushing that off now. They're going to wait until it's something much worse. And I think it's a little bit of a peek into maybe the way things should be. Not that I don't want to see people,
Mhm.
but the spine guy, really the spine surgeon, I should be the last person you're seeing,
Yeah.
right? You, Michelle, should be the first one that they're seeing.
Right.
And I've tried to really, and I've become just through that experience, I've just become more aware of it. It just became more on the tip of my tongue, and going to patients and really using some of those words, like when I see people now, because more people are coming back in. They're like,
Mhm.
"Oh, I hurt my back 2 weeks ago," and I'm like, "Okay, I can direct you in the right, put you in the right direction, but let me tell you why you need to find the right therapist in your network, and this isn't going to be the last time. That person has to become your person, and if that person's not right, then maybe it's another person. But finding that right provider, you're not coming back to me. You need to go to the right person, and so trying to, I think that the pandemic has uncovered gaping holes in our healthcare system, the way it's designed, and those have been there and we have seen them from time to time, but they've really put a spotlight on some of them that I'm hoping is going to really push forward a lot of changes to make health, we need to focus not on procedures in our healthcare system. We need to focus on health and wellness in our system, and then have the procedures there to make the people better that need it.
I mean, we should just end there because that was just such a beautiful statement. And, and of course, I agree with you on everything, which, not physical therapists and spine surgeons don't always agree on everything. But, you're pointing out what the research shows, all of those things. I want to touch on a couple of those points. First off, as a physical therapist, we obviously had to deal with telemedicine as well, and certainly learn and see the wonderful opportunity it is as a way to provide access to people who couldn't get to the office, but also it's a lot more convenient, and sometimes you don't really need to see them in the office. So, really great. How confident are you that our patients will want to continue to utilize telehealth, or do you think it really depends on what the insurers will pay?
I mean, I think that, so on the payer side, I think that there's going to be enough demand that, and the movement, I think it's too hard to stop at this point. I think it's incumbent on us to provide the right experience for our patients, right? They're not going to want to do a telemedicine experience if they feel like it's cobbled together, if they're not really able to connect with their provider, if they don't feel like they're being heard. So, um, telemedicine is in its infancy, really.
Mhm.
It's this, right? It's a FaceTime or Zoom connection.
Mhm.
um, I think that that's going to evolve over a number of years, and as the technology improves, where we can utilize somebody's, Whoop strap, or their Apple Watch, or their phone, to give us some data during that interaction, and then discuss that interaction, right? To be able to give real time feedback to somebody is going to make it a more valuable experience. So right now, it's still in its infancy, but I feel really positive about telemedicine and what it can provide for patients, the efficiencies that it really offers for patients, for providers, for the healthcare system in general. And then it really allows us to do certain things better, in that the people that do need to come in, they have more access to the services that we need. It's some of it might be triaging,
Mhm.
and some of it might be just meeting the patient where they're at. So I think that we have ways to go, but I am really bullish on how telemedicine can really enhance the experience for both patient and provider.
I really like your point about the triage, because I certainly think when we relate it to our people with back pain, now I realize when it comes to the spine, you see a whole host of things to do with the spine. We're not just talking about back pain. We're talking about different kinds of trauma and cancers. I mean, a whole host of things. But when I'm thinking more of the musculoskeletal kind of back pain, fear is a big reason why so many people think, oh my goodness, I've hurt my back. I need surgery. I need to see a specialist. And think the opportunity to be able to have a visual conversation through video conferencing within 48 hours of someone experiencing that kind of pain, just to be able to reinforce those messages, can actually help get them on the pathway to health very quickly, so they're not, in this very fearful state that certainly doesn't help them get to a place of better health, even though the evidence shows that a lot of the time your back pain is going to get better on its own. You've got to just figure out how to manage the pain and the movement and what you need to do to get over that initial acute stage.
No, I love that. I mean, I spend time trying to tell patients, or even when I'm doing talks, that number out there, that 75% of human beings will have an episode of acute back pain. Some studies say even higher, 80 to 90%, where that's disabling, right?
Yep.
Like, that's it. That's not just of like certain populations. That's of all human beings. So it's actually part of the human experience. In fact, I there was a spine surgeon, I'm blanking on his name right now, um, from Canada. I'll think of it maybe in a minute. And we were teaching a course, and he was talking. We had a faculty dinner, and he did a talk for the faculty, and he said, I don't know when back pain what became a disease process and
Mhm.
stopped being part of the human experience. And I was like, that's probably one of the most profound things as a doc, as a spine healthcare doctor, provider, I've ever heard somebody say, because it's so true that we have turned it into a disease process, that something has to be done. And so I'm so on board with what you're saying, that people come see me and that, like, they have to get something done. By the way the system is designed is that if you see a spine surgeon first, you are actually more likely to get spine surgery,
Mhm.
right? So
Yep.
that's completely turned on its head, eh, because the data doesn't really support that. We don't fix back pain. I fix a lot of times leg pain, nerve pain,
Mhm.
and certainly treat tumor and trauma. Those are things, but the majority of the things that we experience is this back pain that is musculoskeletal, like you say.
Yeah, I really love that quote. That when did back pain move from a disease rather than part of the human experience? I wrote it down because I'm like, exactly. And we all do it. I've had acute low back pain before, and it is really scary. And you do start catastrophizing it, but it is really important to have someone who can basically say, you know what, it's going to be okay. This is actually a pretty normal thing, and here's the way things move through in the next few days. Yeah, but you don't need stuff done to you.
Yeah, and pain is, it depends on somebody's pain. Everybody experiences pain differently,
Mm.
and that's not, we're not trying to. Yeah, I do feel sometimes patients feel like we're minimizing their pain, and we're saying no. The really what's behind it, I feel like sometimes, is that patients feel like something is being taken away from them, right? If this pain never ends, then I won't be able to do this, or I won't, and that can be financial, right? That can be social. like a feeling of loss of independence, a feeling that, they can't do the athletic things that define them. There's
Mm.
all these things that makes the pain almost worse because it's the psychosocial part of the pain, not just the actual physical feeling of the pain. Um, and to be honest, we don't have a healthcare system currently that deals with psychosocial issues all that well. So it just adds insult to injury. We have this big problem of many people having back pain. We have all these underlying things that make it even worse, and then we don't have a system that's designed to manage it well.
Completely agree. It's almost like that underlying identity. We all have this belief on who we are. I could think of myself, I'm a strong, active, middle-aged woman who is a runner and all of that. And if I suddenly have acute low back pain, suddenly that's all at risk, and I don't know who I am. And that's a scary thought for many people. And yet, as a where we are, we haven't figured out how to manage that in our healthcare system. But I'm really hopeful. I realize the pandemic was miserable in so many ways, but I do hope that it's helped us all stand back a little bit more and think about our own health, our own identity, what's important to us, and how we manage the healthcare system with that, or with all of that.
Yeah. I mean, before we came on, we were talking about your running, right?
Yeah.
And I do a lot of riding. I feel like this gave me an opportunity to refocus on myself. I actually never spent much time at a gym, and I still, we down here in Wakefield, there's a gym, Manic, that there's one in East Greenwich as well. And, I felt like I was like, okay, we're going to a gym, like I'm gonna have to wear a mask and stuff. But the way they figured it out and having like separate boxes, and yeah, you have to wear the mask, but, figuring out the right types of workouts, I was able to start to redefine what I thought I was capable of,
Mhm.
and really open up my mind. I think that the pandemic has allowed us some space to
Mhm.
rethink ourselves, our careers, all these things that we do. And that's maybe a positive, right?
Yep.
That's come out of this. Yes, there is a lot of negatives, like you're saying, a ton. Um, and depending on from what, socioeconomic situation you're in, rate, depending on your gender, depending on your ethnicity, it's definitely hit you harder than others.
Yep.
But there's these underlying gifts that are out there that you really just have to take the time to look for.
You really do. So let's talk about gifts, and let's talk about exciting things. Ortho Rhode Island has just moved into a brand new building, which is
Yeah.
super exciting, and I'm really happy that construction was able to continue despite the pandemic. So tell us a little bit about this building, and especially what patients can expect, or what new services there are available. I'm looking forward to getting an invite down to get a tour of it. That's just my little side nudge to you and some of your colleagues. But here's your chance to tell a community a little bit about the building and what Ortho Rhode Island is up to.
So I can't believe you haven't been invited already. I mean, I'm probably one of the less important people in the organization. So I would think that more important people than me would reach out to Michelle Collie and bring
I'm
her
not
over.
very
So
important.
this is your invitation. We're going to figure that out. Um, it is super exciting. And I came to Rhode Island from Syracuse 5 years ago with this idea that we were going to create a musculoskeletal center. And really, the idea is to start with orthopedics and expand and get our hands around other musculoskeletal health things, which is coming, right? It's not there yet, but um, the structure itself is just breathtaking. It kind of looks like a sports arena, right? You drive up, you look like you're going to a professional basketball arena, which can be intimidating, but you walk in, it's just very soft. Like it just feels calming. The lighting, just the design of it. It's big,
Mhm.
which can be a challenge for some of our patients, but we have definitely created a flow for patients, and have equipment to help assist patients around the whole building. So we have a new MRI scanner, which I will say I've looked at MRIs from all over the state. It is some of the best images I've ever seen. And there's this big window I posted something on LinkedIn about it. There's this big window in the room with the MRI scanner. And I like to know what my patients are going to go through. So I went down and got in the scanner to say, how's this feel? Because I don't like closed in spaces. And just having that window there made me feel comfortable that I wasn't enclosed. So I'm excited about that. I'm excited about our orthobiologics. In spine, they're not as advanced as some of the hip, knee, shoulder orthobiologic things that people are interested in, PRP, amniotic fluid type of technology. But we're really taking that and running with it. We want to be the leader in that in New England. And so we really have a whole section of our new center there that is focused on that, providing those services. We do have our Ortho Express that's moved over there, which really helps people avoid the ER, which I would tell people, if you have a musculoskeletal thing, go there instead of sitting and waiting in the ER, because you're going to be seen much quicker with an office copay. And then we have our ASC upstairs, where we are able to offer more outpatient procedures that for the people that do end up needing it. So I think that it's a common theme through Ortho Rhode Island is that you're not going to show up. And I hear this from patients, not just mine, but people have seen my partners. You show up here, surgery's not the first thing we're signing you up for, right? We are trying to get you better without a surgery. Because frankly, we're all busy enough without signing up another person for surgery. Like that shouldn't be the point. It's to try to get you better. And that's really what our values are. So that whole building at 300 Crossings right in the middle of the state is supposed to represent that. And I think that the people inside of it will do that as well. We have some of the most wonderful staff that it's all about the patient. They want to give people a good experience. They want to help. They feel like they're part of the team in making somebody better. So it's a great opportunity to just demonstrate that for the Rhode Island community.
Well, it's exciting to have you here in Rhode Island, right in the center of the state. And we always enjoy working with the PTs over there as well. Kyle Anderson and the team over there are a great team, and we're always happy to be out here in the community working with you all, which is fun.
No, we appreciate the work that you guys do too. I mean, it's been a great opportunity in my time here to have folks from performance call me and say, hey, I just want to check in with this patient. They were talking to me about stuff. And I like that interaction because it's really, we're operating on the same plane. We're talking about the patient and trying to get to the best outcome for that patient. So I love that all of your folks are so accessible, and we try to be accessible to the therapists out there taking care of our patients. So,
well, it's a collaborative approach that we all need to take these days, probably more so than ever. Let's have a little fun. Let's do a little back and forth for all those people out there. You've said 70%, maybe it's closer to 80% of everyone's going to have some acute low back pain, which I'd say like basically everyone at some stage is going to have some back pain. Let's hear how many tips we can come up with of how to prevent that happening. So I'm going to go first, just because I'm just the lowly physical therapist. And I'm going to say one of the key ways to prevent back pain is to walk more. Your turn.
My turn. My feeling is stretch more.
Nice. Love a little stretching.
I'm going to throw in there with stretch. I'm going to do another one that's along with stretching is think about trying some yoga. Not necessarily the most difficult poses in yoga, but some yoga.
I'm with you on that, and I actually like to combine my yoga with some functional stretching, strengthening, and tie it all together. So we got a little vote here for yoga. I'm going to say beware of your nutrition. Eating a healthy diet, I don't know if there's one perfect study out there that says eating the good diet helps manage or prevent back pain, but I do know there's got I'd be able to find something. Like be aware of your nutrition. If you're going to live on Diet Coke and French fries, you're going to have more chance having back pain than someone who eats their fruit and vegetables.
Well, one thing that is for sure associated with higher rates of back pain is smoking. Yeah, everybody hears it from the doc, don't smoke. But what smoking, we do know it does, it's the nicotine. It restricts blood flow, which all of our therapists will tell us they do a ton to try to bring blood flow back. But that also, it breaks the actual discs down faster than they would normally break down. So quitting smoking if you haven't already.
I'm going to say, as well as quitting smoking, limit your sitting. Now, it's not sitting that's actually the issue. It's more the staying still and not being active. However, because so many of our jobs require so much sitting, I often say to people, sitting is to the spine like smoking is to the lungs. So limit the amount of sitting, which really is staying in one position for a length of time. I'm here right now at a standing desk. Like, you don't have to stand all day, but you got to change your positions. The spine, no joint, like staying in one position for a length of time.
I will add to that is strengthening your core and understanding that your core is not just your abdominal muscles. Doing doing what is it, 6-minute abs in the Rhode Island movie. Why am I blanking on it right now? Something About Mary.
Oh yeah, something about
6-minute abs. It's not just your abdominal musculature. It's really, your entire core. That includes hip flexors. That includes glutes. There's a ton there that has to do with your core, and getting a good core strength program that you run through 5-10 minutes a day it's going to pay dividends. It just makes you more resilient and more durable. I like that word, durable. It makes you more durable.
I like the durable one too. And I'll add to that just an added benefit, the strengthening, the yoga, the walking, the movement, that actually helps desensitize your nerves. Like, it makes you more durable. It helps you actually, if you had pain, it helps it manage it, but it helps keep your nerves at a level that they don't feel the pain as much. The people who are most sedentary and don't exercise and never move, their nervous system is a little more fired up, so you're going to feel more pain. I'm not going to take that as an item. I love your core, and of course I love the glutes and the hip flexors and all those other muscles in addition to that support the core as well. I'm also going to put in there sleep. Sleep deprivation is very harmful for our health, including our back. And it's not just and it's to do with that quality of sleep. So yeah, make sure you get the right amount of sleep that you need.
I love that. I will add mindfulness, and sometimes that's meditation. So meditation doesn't have to be sitting and listen to gong bats and holding your fingers in a certain position. It can be just a quiet place to just really understand what your body is doing. Having control over your body is part of one of your mind's functions, and meditating is a practice that can help you in a lot of different ways, but can certainly help you with your back.
Awesome. I think we've got a pretty good list there. Have we missed anything?
No, I mean, I'm sure there's tons others if we if we ask other people.
Sure, there's plenty of others, but I think that we really hit on everything. And what I love is that this is a whole list of things. There isn't just one thing there, because so many people say, what's the thing you can do to prevent or stop back pain? And if you look on social media, yeah, do this, do that. But it really is a whole bunch of things. And a lot of them seem like common sense because they're just about being healthy and moving, and being mindful of the habits and ways that you live your life. So great points there. Tell us, Dr. Madom, you've said that you very rarely need to operate. You've obviously given a big shout out to physical therapy, but there are times when people have leg pain, when people have other kinds of symptoms going on. What are some of the other treatment options available? And is there anything new out there that's come available in the last few years?
So, I mean, a lot of what we end up focusing on after a trial of their, even with people with leg pain or arm pain, nerve pain, there's plenty of therapy treatments that will help the majority of them. We often supplement people because they want to leave at the office with something
Mhm,
to help them. And if it's really bad, every once in a while, we might have to give them a steroid, short
mhm,
courses, maybe a nerve medication. We 100% avoid opioid medications. The data is
mhm,
so clear that it doesn't help. You really listen to people who have tried it, they say it doesn't help.
mhm,
They're messy medications with so many different side effects. They're not worth it. Um, it seems like an easy fix, but it's not. So there are other medications that can support somebody through those early stages. If we don't, and so I'm the type of doc that I don't order a lot of MRIs, not necessarily because people show up without one. They often do, but they often get better without the MRI. I tell patients all the time, we don't need an MRI because I'm listening to you, where I'm getting 90% of your diagnosis, and then I examine you, and there's the other 10%. And so the MRI doesn't tell us what it is; it supports the diagnosis, it confirms it, and we'll use it if we're going to talk about maybe a steroid shot. And steroid shots work really well with disc herniations when a piece of the disc spits out and pinches a nerve acutely. It's a new thing. They're also used in arthritic conditions called spinal stenosis. The data is just not as good, but it's kind of like, well, what else do we have? Like, if we're gonna, and the way I frame this for patients is like, you're not trying to. You just said like, people say, how do I prevent getting back pain? Well, you don't. You learn to manage your back pain. You don't. If once you have high blood pressure, you don't stop having high blood pressure. Well, maybe some people do, but you manage it, and you manage it with diet, with exercise, maybe with a medication. That's the same thing. We're managing these issues, and so injections are a way you can manage it. And then
mhm.
if all else fails and somebody says, listen, I have no quality of life anymore because I can't make it from the car to the front door of your office without feeling like I want to cut my leg off. And people use that term. They
Mhm.
don't speak to each other, yet they continue to use the same term. I want to cut my leg off. Then, yeah, then a surgery, then we should be talking about what that looks like. And the new things that we have to offer, um, and it's been developing. I've been doing spine robotics for the past 2.5 years, but I think that it's just now it's real. It just keeps getting better. I have, minimally invasive surgery has been around for 20, 30 years.
Mhm.
And I haven't been doing surgery that long. I've been doing surgery for 12 years, but in the beginning of my practice, it was a lot of radiation and just not. It just didn't seem as accurate. And now with robotics, we can use very little radiation, very accurate results. It's less invasive on the patient, and means that they can recover quicker and then just get back to their active lifestyle as soon as possible. People come in and they say, "Well, after spine surgery? That's it. I can't do anything." That's not true. Even after, if somebody ends up needing like a fusion, let's get you back to surfing, right? Let's get you back to playing golf. Let's get you back to running. I'm not one of the, like, there's no data out there that says that running is bad for your body. It
Yeah.
might be bad. It might be bad for you individually.
Yeah.
As a person, like, I need to treat that person as an individual. So the spine robotics stuff has been just continuing to grow. And I'm happy to be one of the few people that offers it currently. But there's other people. Some of my colleagues in the state are starting to bring it onto their practices. I'm super excited about that,
Yeah.
because I shouldn't be the only person offering it. I think that it's good for patients.
Well, it's really exciting to hear the advances. Robotics sounds kind of sexier then, oh yeah, I'm just going to go in and do surgery. So it sounds like you're doing a sexier surgery, but what it really means is that there's less trauma to the body, and someone can heal better, faster, because there's less trauma. You just get in there and fix what's actually wrong, and get people back to their quality of lives. Because after all, that's what we're all here for, as healthcare providers, to help people's quality of life.
Yep, indeed.
All right, Dr. Madom, you have been awesome. It's so fun to talk to you. It almost makes me want to injure my back so I can come and see you, but I'll try not to do that.
Almost.
Just at times like this. But what I'm going to give you now is 10 seconds for you to summarize your top pieces of advice that you want to give to the community out there. And it probably should be something to do with the spine, but if not, that's okay as well. 10 seconds of your time.
I think that just trying to stay healthy and happy means keeping active and staying moving. And if that becomes a problem, find a good therapist and build them into your network. I think that that's going to pay dividends over the long term. And then if you have issues that they can't get their hands around because it's just not helping you, then we're going to move you on, and then maybe end up seeing somebody like me at the end of the day. Hopefully not.
Dr. Madom, thank you so much. You're awesome.
Good to see you. Thank you.